If that puck had been just 1 inch in a different direction, he probably is blind, if not losing the entire eye. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. We're finally taking a look at some hockey content, and so in this series, I'm going to be reacting to and breaking down some of the most notorious injuries in NHL history. Now, make sure you're subscribed because this is just part 1. There's too many injuries to cover in one video. First up is Marc Staal in 2013. Let's take a look.
Kids as well. Timothée in a shot that hit a body. Oh boy, it hit a Ranger up high. Oh, and he is in a lot of pain. It's Staal. Marc Staal.
Okay, so this injury, of course, was because of the puck that was deflected on this shot that ultimately came up and struck Staal in the face. If you look at this angle here when the slap shot comes in,
that changes direction.
Tough to really see where the puck is here. We're going to get another view to look at this.
Might have been able to turn quickly enough to get it in the cheek. It might have been.
So there's where we can see, of course, the puck and Staal having just been hit. This picture really captures exactly what happened here. We can see the puck that's clearly come up, and honestly, in this view, it looks like it's made direct contact with Staal's eye. Look at this slow-mo clip, though, where we can actually see the puck come up here, and it just strikes him directly in the eye. It looks like, if anything, he might have been fortunate enough that the puck seemed to hit a little bit higher up, kind of just above his eye. If this had been just like an inch lower directly onto the front of the orbit, he's probably blind, if not lucky to even keep the eye. Staal did suffer an orbital fracture, so let's take a look at our biodigital anatomy to understand more about that. Looking at the skull here, and what I've basically done is highlighted all the different bones that are considered orbital bones. There's not one just orbital bone, it's basically a collection of bones that make up the entire socket where the eyeball sits. A fracture to any of these bones in that orbital socket is going to be considered an orbital fracture. Now, one of the big dangers with these is we have a lot of muscles that control our different eye movements that sit here in this space, and those muscles can become damaged or pinched along with the nerves, which can drastically affect the motor function of the eye as much as the vision itself. Thankfully, when Staal came back, he did at least wear an eye shield to lower the risk of future injuries. Next up, 2008, Richard Zednik. Let's take a look.
There's a hit by Jokinen on MacArthur. Oh boy, Zednik, oh my goodness.
So right away you can hear the announcers reacting, and we really can't see much in terms of on-screen what happened here. If we just look at this kind of through here on first glance, it really didn't look like anything too bad had happened in terms of trauma. So now if we look at a different view here, we can actually see what happened. So here's Zednik skating into the play right here, and if you look at the other player on his team, basically the blade of his skate comes up and essentially just cuts him almost with like the sharp end of the skate poking directly into that portion of Zednik's neck. Zednik suffered a laceration to his common carotid artery. We can see that big scar that he had from where that skate essentially punctured into his neck and hit that carotid artery. Supposedly, he also received 5 pints of blood when he was at the hospital. And just to give you some reference, the human body basically has anywhere from 8 to 12 pints. So he essentially had to have almost half of his blood replaced with this resuscitation. The common carotid artery sits right in the front of our neck, up next to the jugular vein. The jugular vein was what Clint Malarchuk had cut when he had his injury. Big thing to remember about veins versus arteries is that arteries are taking blood that's oxygenated from the heart to the rest of the body, as opposed to the veins are delivering that blood that's been used up and the oxygen's been taken out from the body back to the heart. This means that when this artery is cut, that's going to prevent blood from getting up into the brain, which is certainly going to be very serious. When an injury this severe happens, literally every second counts. And so the fact that number 1, Zednik was able to skate off the ice, and number 2, the medical staff were right there ready to apply compression, definitely saved things here until the medical staff were able to actually go in and sew up that cut in the artery. Next, we head back to 2004, and certainly one of the more well-known incidents in just hockey history, period. Steve Moore and the hit he took from Todd Bertuzzi.
His shoulder, having a little chat with him, grabs his sweater, gives him a whack, and piling on in that rainy collision, and everybody's into it. Now we get a line brawl.
So we don't really see right away exactly what happened here. A lot of you probably know the backstory behind this, so I won't get into it. But basically what we could see on this play was that Todd Bertuzzi basically grabbed Steve Moore from behind and just completely punched him in the side of the face when he wasn't expecting it, and that caused him to go down. The other part of this too, not just the punch, but also when Moore's head just hits against the ice, that's also going to be just as likely to cause a major head injury. Now, unlike Anderson, who just had a ligament injury in the neck, Steve Moore actually suffered a fracture of 2 of the vertebrae in his spine, specifically a transverse process fracture of C3 and C4. So C3 and C4 signify the third and the fourth cervical vertebrae. So the atlas here is the first, second, this one's going to be the third, and this is going to be the fourth. The transverse process is a specific area of that bone that was fractured. Now, in the case of these little cervical vertebrae, it's this little tiny kind of hole, this little extension we see off to the side. That's the transverse process. Now, this might not look like much of a bad injury, but there's a reason that our cervical vertebrae have these holes going all the way up. That's because there's an artery that lives in that area. It's called the vertebral artery, and it basically travels up into the brain through that little transverse foramen. So you can imagine if you've got a fracture here, you're at even higher risk of injuring this artery, which can cause strokes and all kinds of much more severe lasting injuries. Next up is our first cardiac event of this video, 2005 and Jiri Fischer.
Incident occurred with 7.5 minutes to go in the first period. Jiri Fischer suddenly slumped over while he was on the bench. Immediately the Wings began calling for
It's hard to see where he is on the bench here.
medical aid. The fans and the players looked on in obvious grave concern as medical staff administered.
So now we can see he's down here, and pay attention to what the medical staff look like they're doing, because it looks like they're administering CPR.
And a defibrillator was brought onto the scene.
Here their coach is explaining what happened. Let's listen and then explain what he's referring to.
What happened basically is Fish was out in a shift. He came off. He was standing there with his teammates or sitting on the bench, and he had a seizure and he fell forward, and then
Okay, so first thing, anytime we see an athlete who's collapsed on the bench or on the field, the first thing we're thinking about is cardiac, because that's going to be the most life-threatening and concerning. It's also important when he talks about a seizure here, sometimes when people have cardiac arrest, they can actually display some seizure-like movements that can sometimes confuse the medical staff or people who are nearby to not be aware that it's cardiac arrest and then not start CPR. So it's important, and we're trained to make sure when an athlete goes down that we kind of disregard the seizure-like activity and make sure we evaluate the heart first by checking the pulse, because it really could be coming from the cardiac arrest.
up on his side, and right away, as soon as we got aware of what was going on, we got it stopped, and we had medical help right away. They started doing CPR on him.
So CPR, of course, stands for cardiopulmonary resuscitation. That's when you see people pumping on the chest and giving those rescue breaths. Basically, when you're in cardiac arrest, your heart has stopped beating, and so you're not getting blood, you're not getting oxygen to the rest of your tissues. So by doing CPR and pushing on the chest, you're basically squeezing and compressing the heart to help it deliver blood throughout the body.
His heart had stopped, and there was no pulse, but they
That's how we know. We check for a pulse. If we don't feel a pulse, we start CPR.
hooked up the auto defibrillator, is what it's called, and they shocked him.
So that shock is basically trying to reset the electrical activity of the heart. When someone has cardiac arrest, they're usually in some sort of an arrhythmia where the electrical activity is abnormal and it's preventing the heart from squeezing. So by shocking it with a defibrillator, you sort of reset the system to hopefully restore those normal patterns. And thankfully, in the case of Fischer, they were able to do that. Next up, 2013, Dan Boyle. Let's take a look.
Outside the line, but now Samoka drives it right back into the Sharks' end. Boyle hit hard down in the corner, and he stays down. And now the
If we look at a different view here, we can see as the Blues player skates in and basically hits him into the boards, you can see his head basically slam up, making contact, boom, kind of right there with the side of the wall. So in this case, Boyle had a concussion, which is certainly no minor thing, but considering the injuries that we can see from a hit like this, he's very fortunate. Whenever someone has a concussion, what can often happen is the brain is basically kind of floating in the spinal fluid, and so it's able to move around inside the skull. So with this impact, Boyle's head basically, boom, makes contact right there at the wall and stops his skull really abruptly, but the brain still moves. The brain slides and hits into the inside of the skull, which causes additional part of that brain injury. Last one, Connor McDavid. Let's take a look.
McDavid flying in, and he crashes into the Flames net.
That is, I'm telling you, to cause that much of an impact to where you knock the entire goal off of its spot there, that is terrible. McDavid had a multitude of injuries to his knee here, probably the biggest of which might have been the PCL, but there was a great story. We'll take a look sometime at the documentary he did, but this is really an interesting comparison to one we'll talk about in the future, which was Steven Stamkos when he broke his tibia with a similar mechanism. Let's take a look from this view as McDavid slides in here, so keep an eye on that leg, basically how it makes direct contact, boom, right there onto the goalpost. Now, the PCL functions basically opposite to the ACL. So the PCL is going to keep the tibia from moving backwards relative to the femur. So here, when his tibia slams into the goalpost, that post is going to produce a force that pushes the tibia backwards. And in this case, it was excessive enough that it caused that PCL to rupture. Now, he could have very easily broke the sort of shaft of his tibia on this play just from how much contact was there. We, of course, know he had some other soft tissue associated injuries with the other structures in his knee, but really amazing that it wasn't so severe that he had to require surgery right away. We'll talk about Steven Stamkos had a similar mechanism like this where he skated into the post and actually broke his tibia. So that's it for the video, everybody. Really excited to bring you guys some hockey content. It's another great opportunity to teach you more very unique injury patterns. Like I said, I've got at least 3 more of these planned out. So let me know down below suggestions, injuries you want to hear about, and so on, so I can bring you guys the best educational content. Thank you as always for watching, and I'll see you in the next one.